over 12 years of working with people struggling with addiction, Hungarian-Canadian physician and author Gabor Maté has gained deep insight into the issue. His approach focuses on the trauma his patients have endured. He emphasizes that addiction is neither a choice, a moral failure, nor a lack of willpower. The way society typically portrays addiction is far from reality. Addiction is also not simply a hereditary brain disease, as conventional medicine often suggests. Instead, Maté argues that addiction is a response to human suffering. This perspective aligns with scientific literature and research, which indicate that addiction is neither a disease nor a conscious choice, but rather an attempt to escape pain, at least temporarily. When Maté began working with addiction, he already had 20 years of experience in family medicine and was deeply aware of how childhood experiences shape adult psychology and brain physiology. He found that all his addicted patients had been profoundly traumatized as children, reinforcing his belief that addiction is a response to suffering. Those struggling with addiction do not need judgment or mere symptom management. They need help healing their traumas. Society and media often depict addicts as desperate individuals, but rarely explore the reasons behind their desperation. The focus is on their urgency to use substances rather than the pain driving this behavior. As a result, these individuals are often oversimplified as aggressive, manipulative, or unpleasant. However, Maté argues that they are essentially traumatized children who have grown up, carrying unbearable emotional pain from abuse and neglect. Their addictions serve as a way to cope. When asked why people turn to substances or addictive behaviors, the answer is simple. They face emotional pain they do not know how to resolve. Addiction becomes a temporary solution. Maté shares his own history as an example. At just 1 year old, his mother had to hand him to a stranger to save his life, uncertain if she would survive another day. Though he has no conscious memory of the event, the emotional imprint of abandonment became deeply ingrained in him. In his book, The Myth of Normal, Maté argues that what we consider normal in our society often contributes to physical and mental pathologies. Emotional experiences directly influence biology, shaping brain development and stress responses. At 53, Maté was diagnosed with ADHD, as were his children. Traditional medicine might see this as proof of genetic inheritance, but he disagrees. He sees inattention not as a genetic disease, but as an adaptive response to stress. He stresses that the human brain is not solely shaped by genetics but by its environment, especially emotional relationships with caregivers. For optimal development, a child needs emotionally present, stress-free parents, something increasingly rare in today's world. Childhood trauma and stress can program a baby's brain, affecting lifelong health. Maté himself developed a pattern of overworking and constantly prioritizing his patients, which came at a cost. His own children grew up feeling unwanted due to his absence. Today, disorders like autism, ADHD, and autoimmune diseases are on the rise. Despite vast investments in healthcare, mental and chronic illnesses continue to grow. In medicine and law, addiction is still often seen as a conscious choice. However, Maté contends that addiction is a response to the suffering caused by childhood trauma. Beyond physical needs, humans have two fundamental psychological needs: attachment and authenticity. Attachment ensures survival through close relationships, while authenticity allows us to connect with ourselves and act according to our feelings. Problems arise when authenticity threatens attachment. Many children learn early on that expressing emotions jeopardizes parental acceptance. To maintain attachment, they suppress their feelings, disconnecting from themselves. This conflict between attachment and authenticity underlies many emotional and physical issues. Trauma is not just what happens to us, but how our nervous system responds to those experiences. Maté argues that true healing is not about changing who we are, but reconnecting with our true selves. The disconnection from our authentic nature causes suffering, and healing lies in rediscovering our essence.